First of all, I would like to to send my greetings and to say hello to all my friends and my colleagues. This is a topic which is especially presented for healthcare professionals, and today I will speak about an important issue, which is insulin resistance. We all know that insulin resistance is the root cause of many medical conditions, and especially relevant to type 2 diabetes mellitus and to obesity or adiposity, and also to fatty liver and to polycystic ovary disease and to hypertension. Five medical conditions, the root cause is what we call insulin resistance, or they are associated with insulin resistance. And the insulin resistance, it means that the body cells are unable to respond to insulin hormone, which is released by, as we all know, by the beta cells of islets of Langerhans of the pancreas. So it is released by the endocrine part of the pancreas in the human body, and this hormone is responsible for regulation of glucose metabolism, as being an important part of carbohydrate metabolism, and also it plays a role, a secondary role in metabolism of protein and in fat or lipid metabolism, as we all know from the biochemical point of view or in the science of biochemistry. So insulin is an important hormone which, number one, plays an important role in the regulation of glucose. And it is responsible for the postprandial lowering of the shooting in the blood glucose, which we call it postprandial hyperglycemia. And this is what we call insulin-mediated glucose uptake by the tissues. In insulin resistance, there is resistance to the action of insulin at the level of the cells, and we have two main forms. The peripheral insulin resistance, which is happening mainly at the level of skeletal muscles or skeletal muscle cells, and the adipose cells or the adipocytes, fat cells, in the adipose tissue of the human body. Especially in what we call the white fat in the subcutaneous tissue, and also in the visceral fat, which is the fat present in the trunk or in the viscera or in the mesentery. We call it the visceral fat, which is related to visceral obesity, and the subcutaneous fat, which is related to the what we call the peripheral obesity or the generalized obesity. In cases of what we call differential obesity, that is, the obesity is not just general obesity, it might be, and as we all know, we have two main clinical types, the apple-shaped obesity and the pear-shaped obesity, depending on whether the fat is deposited mainly in the subcutaneous tissue, that is subcutaneous fat, or it is deposited mainly in the visceral fat, or in both. And this is also related, or this is reflected in some clinical differences between these two types of obesity. But in general, and especially in the visceral obesity, there is what we call the insulin resistance. And the insulin resistance is more severe in the visceral obesity or in the truncal obesity or in the mesenteric obesity more than in peripheral obesity or subcutaneous obesity. But there is insulin resistance in all obese patients. So obesity is one of the important causes of insulin resistance. That's why it is the key root of metabolic disturbances in obesity is the insulin resistance. Also, it is the key pathological feature or a pathophysiological feature in patients with type 2 diabetes in adults. And also in type 2 diabetes in children, which we call it pediatric type 2, because this type of diabetes, or this type 2 in diabetes in children, which is the pediatric type 2 diabetes, also occurs in obese children, that is, children who are suffering from obesity, as an important clinical risk. And this childhood obesity makes the child more liable and more susceptible to develop type 2 diabetes in or during childhood. So there is also insulin. So insulin resistance is a common denominator for type 2 diabetes in general, whether the common type 2 diabetes in adults, which forms 90% of cases of diabetes, or also in type 2 diabetes in children due to pediatric obesity. So there is insulin resistance in obesity and in type 2 diabetes mellitus. Especially if we know that obesity and diabetes, they are linked, as we all know. And most of the patients with type 2 diabetes, they are obese. Unlike most of the patients with type 1 diabetes in children, which we called it in the past juvenile diabetes, they are usually thin and they are usually losing weight, the type 1 diabetes in children. So they are usually slim, they are usually thin, unlike type 2 diabetes in adults who are usually obese. So both obesity and type 2 diabetes, the key or the root cause and the root problem is insulin resistance. Also, insulin resistance is a root cause, and it plays an important part in the development and in the progression of fatty liver disease. So also in fatty liver disease, we get the phenomenon of insulin resistance, or what we call the steatosis, or the non-alcoholic fatty liver disease, or the steatotic liver, or in, as I mentioned, in steatosis, and which might progress later on to what we call steatohepatitis, and even progress later on to hepatic fibrosis and to cirrhosis in the later stages, the 4 phases of fatty liver disease. So insulin resistance also is a root problem and a root cause in fatty liver disease, or in what we call the NAFLD, or non-alcoholic fatty liver disease. Also, it plays a role in the, or it is a key cause or a key feature in patients with what we call the polycystic ovary disease, which is the most common reproductive endocrine problem in women. The most common reproductive endocrine problem in women. Because the most common endocrine problems in women in general is the thyroid problems. But the endocrine reproductive, the most common is what we call the polycystic ovary disease, or the PCOS. So also here there is insulin resistance. That's why among the therapeutic options in patients with polycystic ovary disease, to give the patient what we call insulin sensitizers, to sensitize the tissues to the action of insulin, and help to halt or arrest the pathological progression of metabolic changes in patients with polycystic ovary disease, or in women with polycystic ovary disease. So it is a root cause in insulin resistance, is a root cause in obesity, in type 2 diabetes, in fatty liver disease, in polycystic ovary disease, and then come number 5, also in some patients with hypertension. Among the theories of pathogenesis and pathobiology of essential hypertension is chronic inflammation. There is what we call endothelial dysfunction and inflammatory response, or systemic inflammatory response, with insulin resistance also. So in hypertension also, it can be considered among the pathophysiologic or pathobiologic changes which help in the development, or which are involved in the development and in progression of hypertension in some individuals, not in all individuals, because the pathophysiology or the pathobiology of hypertension is different in different patients with primary or essential hypertension. I'm speaking about primary or essential hypertension. But it can also play a role in some forms of secondary hypertension, especially in what we call the endocrine hypertension and in pancreatic hypertension, that is hypertension due to pancreatic causes or hypertension due to endocrine causes, which are considered among the entity of secondary hypertension. So insulin resistance can be met with in primary hypertension and in secondary hypertension as well. So this is the root causes. Not only this, it is very important to know that insulin resistance and the inability of the body cells to respond to, or the defective response of body cells to the actions of insulin at the peripheral level and at the central level, as I mentioned, peripheral level in the adipose tissue and in the skeletal muscles, and the central level of insulin resistance, that is insulin resistance at the level of the liver. So we have central insulin resistance in the liver, peripheral insulin resistance in the skeletal muscles and the adipose tissue. These are the most important peripheral tissues which are involved in insulin resistance. And this insulin resistance will cause what we call hyperinsulinemia. Hyperinsulinemia, that is, there is elevation of the level of insulin in the blood of such patients. Unlike insulin deficiency in patients with children with type 1 diabetes, for example, because in this type of diabetes, type 1 diabetes children, there is abnormality in the pancreas, pancreatic deficiency with insulin deficiency. That is, there is some problem in the production and secretion of insulin from the beta cells of islets of Langerhans in such patients. But here, this is in cases of type 1 due to insulin deficiency. But in insulin resistance with hyperinsulinemia, which is involved in the other pathological conditions and the others, as I mentioned, in obesity and in type 2 diabetes, there is hyperinsulinemia. This insulin resistance also might be related to certain types of cancers. There is a link between insulin resistance and certain types of cancers in the human body, especially to mention the cancer breast and cancer uterus and cancer lung. That's lung cancer, that's cancer lung, and patients with breast cancer and patients with uterine cancer and patients with kidney cancer. That's renal cancer, especially the hypernephroma. So there is a link between insulin resistance and also cancer development and the pathobiology of cancer. Simply because, what is the link? What makes the patients with insulin resistance and hyperinsulinemia, they are more liable to have cancer? Because of many things. Number one, the hyperinsulinemia itself. The hyperinsulinemia, it allows the tumor cells to develop and helps in tumor cell division and stops the what we call the cell death. Stops the cell death. So it prevents the death and deterioration of the tumor cells and helps in the flourishing of the tumor cells and the tumor cell division, as I mentioned, the hyperinsulinemia. Also, it is related to some endocrine changes, hormonal changes, especially the link between hyperinsulinemia and the insulin-like growth factor 1, or the IGF-1, insulin-like growth factor 1, which also is related to the development of carcinogenesis and the development and the growth of cancer cells or tumor cells, especially in cancer, as I mentioned. So the relation between hyperinsulinemia and the insulin-like growth factor 1 also is an important link for the development and progression of oncogenesis or tumor development and cancer development in the human body. And also the relation between hyperinsulinemia and the state of chronic inflammation in the human body, which also related to the oncogenesis and the liability of the normal body cells to transform into malignant cells, or in neoplastic transformation of normal to neoplasm or to malignancy or to cancer. So this is through the state of systemic inflammation or chronic inflammation at the level of all body tissues and organs, putting the tissue at risk of cancer development, systemic inflammation. So hyperinsulinemia and systemic inflammation or chronic inflammation, hyperinsulinemia, and it's linked to insulin-like growth factor 1, hyperinsulinemia, and its direct relation with the tumor cell division. And also, number 4, the glucose availability, and it fuels the tumor cells with the essential nutrients, especially glucose, to flourish and to divide and to progress. And this is important in the biological course of cancer, or in the pathobiology of cancer, or in the biological behavior of cancer and cancer development in the human body. So through, as I mentioned, glucose hyperglycemia and its relation to tumor development. So the link is through many things, as I mentioned, the hyperinsulinemia, the metabolic changes, the hormonal changes, especially insulin growth factor 1, and the systemic inflammation, and to also hyperglycemia and glucose availability to the tumor cells. So the link of hyperinsulinemia or insulin resistance with cancer development and its relation with some types of cancers, solid cancers in the human body, as exemplified by uterine cancer and breast cancer and kidney cancer and even pancreatic cancer, is through these mechanisms which I mentioned. This is very important to remember in clinical practice and as regards the insulin resistance. How to improve the insulin resistance? This is very, very important through lifestyle modifications, by exercise, by having a healthy eating style, by certain foods which improve the insulin sensitivity in the human body, like the lean fats, like the consumption of low sugar fruits, and the consumption of non-starchy vegetables, and the consumption of lean proteins, which are low in fats and in calories and more having essential amino acids, and through also the consumption of what we call complex carbohydrates and the high fiber food options, like the whole grains and cereals and legumes, which provide the body with anti-cancer substances, and with substances which improve the insulin sensitivity and decrease the insulin resistance. So this is a very basic and very essential as a natural way to treat insulin resistance, which is linked to many diseases in the human body, as I mentioned: diabetes, obesity, hypertension, steatosis, liver steatosis, that's fatty liver, and polycystic ovary disease, and even to some types of cancers in the human body. Focus on what you eat, focus on having a healthy lifestyle, and healthy eating as a part of healthy lifestyle is very important, in addition to exercise, in addition to avoiding stress, which is related to cancer also, and is related to diabetes and related to obesity. Stress, and having good sleep. Professor Dr. Tarek Ali.